Good morning to you all. My name is Dr. Gyamera, and I'll be discussing depression and anxiety with you this morning. In this presentation, we'll try and understand depression and anxiety and how to combat them as tertiary students. I hope you enjoy the presentation. Now, the objectives at the end of the day would be to define depression, define anxiety, list the differences and similarities between anxiety and depression, state the options of management for depression and for anxiety, and then explain how you would reduce stigma, stating your role as a university student. Now let's look at the outline of the presentation. We would quickly define mental health, go through the definitions for both depression and anxiety, and then look at stigma associated with mental illnesses, then end with your role as a university student. Now, the World Health Organization, WHO, defines mental health as first a state of well-being. It's important that we recognize the first statement as a state of well-being. That means that my mental health today may not be the same as my mental health yesterday or tomorrow. It also means that my mental health this morning may not be the same as my mental health by evening. It's about the state of well-being at the time it's being assessed. Now, it's not just a state of well-being, but it's a state of well-being in which the individual can do 4 things. So what are those 4 things? You should first realize your own potential and abilities. You should be able to cope with the normal stresses of life. You should be able to work productively and fruitfully, and then you should be able to contribute to your community. Now, if you are unable to realize your own potential, unable to cope with the normal stresses of life, work productively and fruitfully, or make contribution to your community, that is, make meaningful contribution to your community, then we say that you don't have sound mental health. It's important to appreciate or learn here that saying that someone does not have sound mental health is not the same as saying that they have a mental illness. Telling you that you don't have sound mental health is not equal to telling you that you have a mental health diagnosis. It doesn't mean you have a mental health disorder. It just means that you don't have a state of well-being at the time you're being assessed. What then is a mental disorder? What then is mental illness? To say that someone has a mental disorder or mental illness, we expect that we can look at 3 things. We expect 3 things to be present: duration, deviation, and distress. Now I'll take them one by one. When we say duration, we're looking at timelines. And so we expect that whatever has been going on with you, that is your state of well-being, has persisted for a period of time, has gone on for a period of time. For depression, we're looking at a minimum of 2 weeks, as we are going to learn as we go along. For other mental disorders or illnesses, we look at a minimum of 1 month, sometimes 3 months, 6 months, sometimes even up to a year. The point is that whatever symptoms you are exhibiting that is causing a state of unwellness persists for a duration of time. Now, whatever symptoms you are exhibiting that are persisting for a duration of time should exhibit a clear change, a deviation. There should be a clear change in your thinking, in your mood, or in your behavior. It can also be a mixture of either of the 3 or all 3, but there should be a deviation. And this deviation that has gone on for a period of time should cause significant distress to you as an individual and to your community. That is when we say you have a mental disorder. That said, I'd like us to look at depression first before we go on to anxiety. Now, depression is not just a state. It's not just about the mood at the time. Like we said, by the time we're saying that there's a disorder, it should persist. Okay, so depression is a mental illness. Depression is a mental disorder. We say that someone has depression when they have had persistent symptoms for a period of at least 2 weeks. And these symptoms have caused significant distress to that person. The distress may be seen in terms of their functionality, in terms of their function. So they are unable to go to school or work, or they are unable to sustain or maintain relationships. That is the distress we are talking about. Now, there are 3 core features of depression. When you have 2, we say that the chance that you may be depressed is high, and so you need to be assessed by a mental health professional. However, when you have just the last one, which is the loss of interest in previously pleasurable activities, we also say that the chance that you may be depressed is high. That is, the chance that you may have clinical depression is high, and so you should be assessed by a mental health professional. There are other symptoms of depression, as we all know, but these are the core symptoms. These are the core features. When these are present, then we look for the others. What then are the others? We know a number of them already, so I'll quickly just go through. There are changes in diet, or appetite. So the person may be eating too much or too little. They may be sleeping too much or too little. They may lose interest in sex generally, or a sex drive, or a reduction in sex drive. They may lose concentration. They may even have suicidal or homicidal ideas. Now, anxiety. Anxiety means an intense, persistent, and excessive worry or fear. Now, fear is your emotional response to danger. This danger may be real or it may be perceived. Anxiety is the anticipation of future threats. So if I have exams in a week, I may be anxious about that exam. That exam becomes the future threat. There may be fear that I might fail, and in this case, it's perceived danger. It's not real. Now, this means that anxiety can be good, because then it might prompt me to read better or learn harder. So some level of anxiety is good, but when it's intense, persistent, and with excessive worry and fear, we say that you have an anxiety disorder. Now, the symptoms of anxiety can be seen in every system of the body. When you take the central nervous system, you can have dizziness, you can have headaches. Some people even experience blurred vision. They are unable to see clearly when they are anxious. When you take the heart, you can have an increase in heartbeats. So if I ask any of you to do a presentation in front of your classmates, you may have some of these symptoms. And in that case, when it's just a state of unwellness, at that time, your mental health may be poor. It doesn't mean you have an anxiety disorder. But when these symptoms, as stated in the slide, persist for a period of time, that's the duration, and cause significant distress, then we say that you have an anxiety disorder. I hope it's clear up to this point. Now, when we take depression and anxiety, they usually go hand in hand. Someone with an anxiety disorder can develop a depression or a depressive illness. Someone with depression or a depressive illness can also develop an anxiety disorder. So the two usually, we say, are comorbid. They usually go hand in hand. So when you find one, there's a need to look for the other. Now, depression and anxiety have some drivers. They have certain events that precipitate or worsen them, that perpetuate them. And I looked at a few that we can relate to as students. And so bullying, for instance, can worsen an existing depression or trigger a depressive episode. Now, I'm using the words trigger, drive, worsen, precipitate, perpetuate. I'm not saying cause. So we are not saying that these things or these situations cause depression. No. For the cause of depression, there are biological causes. There are other causes as well. There are some people that are born with depression. Yes, people can be born with depression. It is these events that trigger the depressive episode. It doesn't mean the depression wasn't already there. It just hadn't been triggered. All right. Now, what do I do if I don't think I have a depressive illness or an anxiety disorder? What do I do? Do I sit back, relax, and enjoy my life? No. There's the need to protect your mental space. So what are some of the things we do to protect our mental space? What are some of the things we do to protect ourselves from developing a depressive illness or an anxiety disorder? Engage in a sport. Be deliberate about your exercise routine. Now, in this case, we are not saying that you should start going to the gym or start jogging about if you were not already on any routine. But if it's about walking to class every morning or walking back to your hostel at the end of the day, if it's about walking to science, if it's about standing every few minutes, whatever your exercise routine may be, no matter how insignificant it may seem to you, just be deliberate about it. Just be conscious of it while you're doing it. It can also be a mental exercise, like reading a book. Be deliberate about it. Be intentional about reading a book. Be intentional about solving a puzzle or two. Then there's the need to maintain a regular sleep schedule. So if you're sleeping at 10 p.m. and waking up at 4 a.m., you should continue with that. Be deliberate about it. Don't mix it up. Don't sleep at 8 p.m. and then wake up at 10 a.m. And then, don't be having a regular sleep schedule helps protect your mental space. Is what we are trying to see here. There's also the need to engage in extracurricular activities. Yeah. Now, when a person is depressed, so these are the things we do when we are not depressed or anxious, or when we don't have a depressive illness or an anxiety disorder. What do we do when we think we may be depressed? What do we do when we think we may have an anxiety disorder? We've looked at the symptoms of each of them. So by now, some of us are already thinking, am I depressed? What do I do if I am? The first thing is to consult a psychiatrist. So the list here is in order of priority. You need to consult a psychiatrist. Consulting a psychiatrist doesn't mean you have having a mental disorder is not equal to being mad. Usually, by the time people are using the word mad, they're referring to about 10% or less of what psychiatry is about. They're referring to psychosis. In this discussion, we haven't even discussed psychosis. We haven't even talked about psychosis. If you have a depressive illness and it's not taken care of, it can graduate or worsen in severity to include psychosis. So yes, you can have a person who is depressed roam about the streets naked. You can have a person who is depressed hear voices. Those are symptoms of psychosis. Those are the things we think about when we think psychiatry. Because when we think psychiatry, most of us end up thinking mad. Consult a psychiatrist before it gets to that point. Unfortunately, there are not many psychiatrists. So when you can't find one, you can find a psychologist. If you can't find a psychologist or you can't afford one, you can find a counselor, and the list goes on in that order. Now, I would like us to quickly look at stigma and then end the presentation. It's important to discuss stigma whenever we are discussing mental health conditions, because there's so much stigma surrounding mental health, and it affects our health-seeking behaviors when it comes to mental health. What is stigma? Stigma is a complex social process. It's made up of both real characteristics and perceived characteristics. and it results in socioeconomic exclusion. We'll look at types of stigma, but I'll dwell on just two. I'll dwell on experienced stigma and internalized stigma. Experienced stigma is how your friends treat you when you say you are going to see a therapist, when you say you are going to see a psychiatrist, when they realize that you're on medications for people with mental illness. That is experienced stigma. That's social isolation. That's behavior, that discrimination. That is what experienced stigma is. What the person that is suffering the condition experiences from the environment. What internalized stigma is, however, is the stigma the individual that's suffering the condition imposes on himself or herself. Quick example, someone has epilepsy and then says to himself or herself, I can't run for SRC president. I'm epileptic. They call themselves epileptic, and then they prevent themselves from engaging in certain activities. That is internalized stigma, stigmatizing against yourself. And it's common because of the experienced stigma, because of our upbringing, because of all the biases, all the all the spiritual clouds that's shrouded in mental illness and other stigmatized conditions. Internalized stigma is a thing we should start looking at and try to change, because it is this internalized stigma usually that causes the consequences of stigma we're going to talk about in the next slides. Now we're going to take each of them one by one. So we'll first look at psychosocial effects, then we'll look at the behavioral consequences, and then the effects on health. So still discussing the consequences of stigma, psychosocial effects include silence, which is why they won't even talk about their mental health challenges, which is why they won't want to mention any challenges to anyone before they will say that I am mad, mean I should go and say. Then they will say that, so it results in silence, it results in secrecy. There's also some blame and shame that a person imposes on himself or herself. This is usually because of the spirituality, the whole you must have been cursed, you must have done something wrong. If you're a guy, you must have broken a girl's heart to be suffering this condition. So there's that fear, guilt, blame, and shame as well. How do these things affect the behavior? There's a lack of disclosure and a delay in care, as we have talked about, and there's discrimination. There's also violence. Yes, people who have mental illnesses are violated in so many ways. Their human rights are violated on, they're trampled upon too often. There's also the part where they refuse to take medications because of the same reasons, and they don't practice prevention for other conditions, other mental health conditions, other physical conditions. They just stay where they are and decide that, well, what can come. And how does that affect health in general? There's transmission of infections. If you have a person with mental illness who has refused to take their medications for another condition like HIV, maybe they had the diagnosis of HIV and that precipitated or triggered a depressive illness. As a result of the depression, they decide they don't want to take the medications anymore. There's going to be an increase in morbidity and mortality for that condition, as well as the depression. And then there's the chance that they can transmit the infection to another person. We've talked about the risk of violence, and then there's the general problem of poor mental health globally. How do we reduce stigma? What's your role as a university student? What would you like done for you? if you had the condition that is stigmatized against. There's the need to establish empowerment groups. We need to create advocacy groups, contact intervention, find people we can talk to. The best form of advocacy is getting help for the people who suffer the stigmatized conditions. And it's important to state here that educational information is never enough. You need to act. There's so much we can do. Finding who to call, where to get help from, when to get help, so that when someone needs help, we are available and we can help them. It's enough advocacy. Thank you very much. These are my references, and I hope you enjoy the presentation.